internally they were writing that like I had psychological issues. The reason that I'm saying the things I'm saying is because I have a psychological problem, probably related to childhood trauma. I want attention. Here's a really great phrase they use. I have intellectual narcissism. Okay, intellectual narcissism. I enjoy the notoriety, but so when people started criticizing me back and saying all these things, I doubled down because this is like an important thing that I'm saying. And then you're trying to get me kicked out of med school for saying the truth, right? Like I'm saying something that's at least really important for us to have debated. And many of the things that were said by Fauci and Walensky were categorically wrong, like categorically scientifically wrong, like indisputably wrong. And yet you're not allowed to say that. And you're going to get kicked out of med school for adhering to science, right? Like adhering to the high standards and things that are very straightforward and simple, in my opinion, categorical. You're going to get in trouble for that. So I doubled down, as I should not have done. As I talked to you, Anish, on the phone, you're like, they're going to kick you out. You're on the phone, Anish, you're like, they're going to kick you out. But they're definitely going to. And you were like one of the only ones who saw it clearly, because my understanding is that you understand how things work like really well on this side. And I was like, yeah, we'll figure out how to do it. We'll figure out how to get through this thing. It was savage. And yeah, they absolutely did.
If you like your healthcare plan, you keep your healthcare plan.
Nobody knew that healthcare could be so complicated.
We finally beat Medicare.
This is the Doctor's Lounge.
Okay, we are live here on X with the Doctor's Lounge, and today we have a special guest. Our guest is Kevin Bass, and of course, co-host Dr. DiGiorgio from the People's Republic of California.
No, I am broadcasting live from the Big Easy. I'm in New Orleans.
That's right.
Yes.
I remember you saying that. New Orleans. That is the
live.
Big Easy.
Yeah, live from Louisiana.
All right, wonderful. About to have some gumbo. What are you doing in New Orleans?
Oh, gumbo's fantastic. Yeah, I'm giving a course on spine surgery. So brought the family. I did my training here. So wife hasn't really been back since we left for California. So now it's a good chance to revisit the good city.
Outstanding. Well, Dr. Bass, thank you for coming. Dr. Bass, that's a slip there.
Technically, I am Dr. Bass.
Your PhD, Kevin Bass,
go.
PhD. Dr. Bass, thank you for coming on. Your arc has been one that many have been watching, partly because you are prolific and much followed on the platform now known as X. I first heard of you like a while ago because you were a truth teller about nutrition science and a bunch of different stuff that was kind of, weak, fatty type stuff. And you were kind of had, you're a very effective communicator. And so you would, get to the heart of the matter in terms of what was BS and what was not. And so that's how I first heard of you. And then kind of COVID happened and you really blew up with COVID because you went from kind of saying what the general establishment was saying in terms of vaccines and lockdowns and all that. And then as time went on, I mean, partly because you had a vaccine and then you actually had pericarditis from the vaccine, as I recall. And that was in some ways a red pill moment for you. And then you started to kind of, more closely evaluate, what the institutions were saying. And that led to you writing a pretty viral piece in Newsweek talking about how you were essentially apologizing for kind of being on the other side and kind of being condescending and et cetera when you were on that side. And that piece went mega viral. You eventually went on Tucker Carlson. You're an MD PhD student at Texas Tech Medical School. And then kind of, the crap hits the fan at that point. And I'm very interested I want you to tell, the story since then, because it's an incredibly instructive story for the lay public, as well as for medical trainees, especially to kind of, know about your story. So Kevin, welcome. Thanks for coming on. Thanks for giving us the time to do that.
Yeah, no, thanks for having me on. Appreciate it a lot. I'm looking forward to talking to both of you. So,
yeah.
likewise.
So tell me, Kevin, go from if that's okay, can you describe somewhat of what happened? Can you take it from where I left off in terms of your story?
Yeah. So, as soon as I had the Newsweek piece, I thought, what my perspective was when I was writing about nutrition. And it was a very similar perspective when I started writing about COVID. I thought, the institutions work. They get some things wrong. Usually they're minor It's not going to be that big a deal. And they self-correct eventually. Maybe it takes 10 or 20 years longer than it should. And, maybe they change the cholesterol guidelines, the cutoffs, or sometimes they become more aggressive, I think, anyway. But in general, they get things right and they're self-correcting. And that's sort of the belief. And I truly believe that. I thought everybody who thought that the institutions are not self-correcting, I thought they're crazy. I thought they're completely crazy. Those were quacks to me. But on COVID, I realized that there's a lot of stuff. And so the reason I believe the COVID narrative is because I didn't look into it. So I was really good at nutrition, but I just assumed, of course, if they're saying making these very strong statements about masks and lockdowns in particular, and to a lesser extent, I think vaccines, but it happened with vaccines too, although maybe many listeners will completely disagree and think it's the opposite. But I think, they made these strong statements. It had to be right. And so you should support the public health. They're using science. They're trying to save lives, right? And anybody who goes against that is a quack and probably a really bad person. So when Jay Bhattacharya started sending replies to me, simply reading the material he was sending me felt transgressive. I was reading this material, I was like, oh my God, this is bad stuff from Jay Bhattacharya. He's a bad guy. And that's sort of the establishment perspective, right? If you're on that side of things, you still think that way about Jay and about Vinay, and you're cheering that Vinay's out right now, and you hate Marty McCary. So I thought all that, but then I started the more I got into it, the more I started reading, I was like, holy crap. This actually, at minimum, at the time, I always think, at minimum, this is a really big debate that should have happened. And it should have been in public because really prominent, really important experts, the best experts in some ways before the pandemic happened. For example, the smallpox guy, Johns Hopkins, his name is escaping me. He wrote the paper with, he wrote a 2006 paper about how to deal with pandemics. Some of the best experts had a legitimate counterpoint, but there was sort of a mob mentality, especially around a pandemic. It's an emergency, obviously, and this happens all the time, actually, with pandemics. You have this sort of hysteria, and you have a lot of groupthink. It's happened for hundreds of years. There's been controversies like the one I was involved in for hundreds of years. It was a hard-won battle where we stopped actually doing mass quarantines in Great Britain in the 18th and 19th centuries. And so what I realized is we had a hysteria, we had groupthink. And then once people started saying Kevin's a quack, he's grifting for Twitter money, which, you're not making any money on Twitter. You're not making any money on social media at all. So, but, he's grifting and he's doing this for whatever reason. At my school, when I got the internal records from my FERPA requests, I got these records, I think at the beginning of last month. Internally, they were writing that I had psychological issues. The reason that I'm saying the things I'm saying is because I have a psychological problem, probably related to childhood trauma. I want attention. Here's a really great phrase they use. I have intellectual narcissism. Okay, intellectual narcissism. I enjoy the notoriety. But so when people started criticizing me back and saying all these things, I doubled down because this is an important thing that I'm saying, and then you're trying to get me kicked out of med school for saying the truth, right? I'm saying that something that's at least really important for us to have debated. And many of the things that were said by Fauci and Walensky were categorically wrong, categorically scientifically wrong, indisputably wrong. And yet you're not allowed to say that. And you're going to get kicked out of med school for adhering to science, right? Adhering to the high standard science and things that are very straightforward and simple, in my opinion, that were categorical. You're going to get in trouble for that. So I doubled down, as I should not have done. As I talked to you, Anish, on the phone, you're like, they're going to kick you out. You're on the phone, Anish, you're like, they're going to kick you out. But they're definitely going to. And you were one of the only ones who saw it clearly, because my understanding is that you understand how things work really well on this side. And I was like, yeah, we'll figure out how to do it. We'll figure out how to get through this thing. It was savage. And yeah, they absolutely did. You guys know about Sham peer review. It was Sham peer review.
Conversation that we had, because your Newsweek piece went viral, right? I mean, just to go over, I tweeted the snapshot of it. As a medical student researcher, the title was, "It's time for the scientific community to admit we were wrong about COVID and it cost lives."
That wasn't my headline, by the way. And a lot of
Yeah.
people like read just that piece and
Right.
see the headline and they say, oh, he's a, okay.
Right.
So.
Right. And then, but you said as a medical student and researcher, I staunchly supported the efforts of the public health authorities when it came to COVID. I believed the authorities responded to the largest public health crisis of our lives with compassion, diligence, and scientific expertise. I was with them when they called for lockdowns, vaccines, and boosters. I was wrong. We in the scientific community were wrong, and it cost lives. And I think that, coming from an establishment MD PhD guy, that Newsweek piece for that reason went super viral. And you're writing that actually. And you're writing that January 30th, 2023. It's like years after this stuff has gone on. It should be relatively obvious by then that everything you're saying is true. And then I think, you got a call from the producer for Tucker Carlson. And that's when I think we had the conversation about what happens about should you go on Tucker or not. And I specifically said, I think we still have the messages saying, don't do it. You will not graduate from medical school if you go on Tucker.
You're right.
But when I told you that, what did you? I know you internally. You heard it and stuff. But did you not believe it, or did you believe that if they tried to do that, that the system wouldn't allow that to happen?
I believe that if they tried to do that, the system wouldn't allow it, and I still think that's the case. I mean, I may not be a doctor, but I still think the system will eventually work.
Right.
I didn't know that I would be removed for sure. I didn't know I would end up.
Right.
It would go this far. Yeah.
Because it's an insane thing. I mean, it's not. I mean, I think most folks believe that we live in a country where you can say what you want, and as long as you're not trying to harm or hurt people, like there shouldn't be some crazy response to that. So you've been through this terrible thing. I mean, I felt terrible watching you kind of go through this. Can you how did it? Whatever you're allowed to say, because I know I don't want you to say anything that'll get you in more trouble or anything like that. But can you describe some of the things? I mean, you've been tweeting about it, and you've had a Freedom of Information stuff, that Information Act request for documents and stuff that you've been putting out. But can you give me a sense, and can you give the audience a sense of what happened and how they went after you? Because they didn't go after you because you published something or that you went. They didn't say you went on Tucker, I'm going to cancel you, right? And I said that is not how they're going to do it.
So the only problem with this part is I have a lot of facts that I've used to establish sort of the plausibility of what they did. And it's all in the docket. I have, I think, 130 paragraph third amended complaint that still needs to get approved by the judge. And they just tried to dismiss it, but it's all in the docket. So that's not a problem. The only thing is I probably can to some extent connect the dots. So here's what they did.
You can say, you can speak generally. You don't have to. You just
basically, speaking. There was an escalating series of professionalism complaints, something on the order of 50 separate allegations that were made. If you look at the internal record, which, as I said, I got in January, there was an escalating series of emails internally. I never knew about this. Any of this was happening. I never knew that nobody ever, emailed me and said, we need to talk about this. Nothing. But there was an escalating series of emails starting at the day that my Newsweek piece was published. There was a big flurry of emails among the senior administration at the school about an incident. They called it an incident. The publication of this article was an incident that they had meetings about, and they had to figure out a response to, which is incredible to me. It's this sort of bureaucratic language where truth and whether it's true or false is not an issue. It's about managing sort of a bureaucratic problem, specifically the PR problem of my publication of this piece and the reaction it was getting. And that's all that the bureaucrats were concerned about. And then, by a couple weeks, 3 weeks before I started getting the first hits, or it's 2 or 3 weeks, the dean of the medical school, Stephen Burke, asked for my, the honor code that I had signed as a medical student. Again, this is all internal. I didn't know any of this was going on. He asked for it. They gave it to him. They're all CC'd on me. And he's like, okay, what rotation is Kevin on? What rotation is Kevin on right now? And then in 3 weeks, I started getting hammered. And then maybe about 1 or 2 weeks after he sent that internal emails started hammering me that I didn't know about. Suddenly, out of nowhere, you got these really long narratives about everything I was doing wrong sent by the clerkship directors to the administrators. So that is the factual set of connections, Yeah. And the initial complaints were non-specific. Nobody would tell me what I had done wrong. Nobody would tell me what I had done wrong for months, but I kept getting more of them. And I would go to these hearings and they wouldn't tell me what I did. I would be defending things that I would be guessing what they might be thinking. And I'm like, and I'd be explaining things that like they wouldn't tell me. They wouldn't put it in the documents. They would have meetings with me making specific allegations. I would be like, you guys need to put this in writing. They would refuse to put any of it in writing. Some of the allegations were incredible. They're outrageous. And I was like, you guys got to put this in writing. And they would put it in, they'd write a page where they would actually not say what happened. So, this was a part of a plan. They've probably done this to other people many times. Then I won the appeal. So I had 2 hearings. It was the most stressful thing ever. I knew something was wrong, but I was also being advised by people to basically not fight it and be like, is this a conspiracy, guys? Like, is this, because I was playing by the system. I was assuming that I just respond to these things and play by the system, then it'll work itself out. So I won after the appeal hearing, which I won the appeal hearing, probably because the lawyers are like, you can't have him lose this thing because this looks really bad. You have to let him win. And I won on the basis that the allegations are non-specific. Nobody knows what I did. There's nothing, and my performance is good. But if I have another professionalism, even though I was like considered cleared, they also said in the letter to the second hearing, the appeal hearing, if I have another professionalism complaint, I'm immediately triaged back without talking to the administrators, without being able to work it out, immediately triaged back to the professionalism community again. I knew that whenever I got that letter, I was cleared, quote unquote. I knew I was screwed. I knew that they were going to hit me again immediately, which is exactly what they did within like a week. They had another one, but this time the new set of professionalism complaints were extremely specific. There were crazy distortions of things that happened or falsehoods, like straight up falsehoods. And then I started getting hammered with those. And then at that point, I started filing grievances because I was like, you guys are going to put me through more hearings again. I'm not really going to be able to defend myself. You might actually find me guilty this time. We'll have these, I'll actually tell the truth of what happened in the grievances since I'm not going to be able to do it during the hearings. During the first hearing, I never got a chance to. And then, we'll work it out through the grievance system, which I thought was, and according to the student handbook, I had this right. And I had this right to have the grievances heard before the hearings. So I was dumb enough to make a tweet, although, I don't know if I regret it. Tactically it was dumb. I made a tweet, and you're going to love this extra tidbit about it. You probably know about the story, but the tweet was basically, we're all going to die. We're all going to die very soon. And given this, why do we worry so much about what other people say or think about us? Obviously, it's a reflection on like vanity. But then they took we're all going to die very, very soon. And they said, Kevin, basically there was already this hysteria about me at the school. Kevin's a crazy person. He's actually sort of making a veiled threat to kill everybody. Basically. And it's like, I laugh because I have to, right? It's such it's so crazy. I have documentation showing that at the time, contemporaneously, 8 administrators knew this was false, including the person who signed the threat assessment team thing that said I need to be removed from campus, the criminal trespass warning. This guy knew it was false at the time he signed it. The day after, he told me he knew it was false. He told me he knew it was false, that this was a threat. I have it on recording. Right? I have that on a recording I took of that conversation. But people felt threatened, quote unquote, by the grievances I had been filing. They were afraid. Here's the interpretation. They were afraid the truth of them lying about me in clinical evaluations was going to come out through these grievance hearings, right? So I got removed off campus, actually banned from campus for a year. I had to go with police officers in order to be on campus. They consolidated everything into a consolidated hearing where they told me beforehand, you're going to have the grievances heard and we're going to go issue by issue. None of that happened. They hired a person from the outside to do this. This guy's name is Darren Gibson. Darren Gibson is a Harvard-trained lawyer who works for Littler Mendelson. He's one of the defendants on my lawsuit. Darren Gibson is responsible for throughout a significant number of institutions in higher education. He's responsible for the grievances and conduct hearing type things in many universities, creating the protocols that handle those, as well as Title IX. And he's often taken on as an independent adjudicator during these hearings. Now, it gets even deeper than this. I wish I could really go deep about this particular issue because it's very interesting. This is the guy in charge of about half the systems, the public systems in Texas. And he's also the guy who adjudicates these things. I'll go ahead and say it. He has the way that his system is set up for these hearings. He has set up certain sort of discretionary clauses at any given major decision point where he has hearing officer discretion. What that means is all of this paperwork that alleges you have due process at all of the major decision points. You don't, but it's a beautiful system. You have many pages laying out this beautiful system where it's very professional by this Harvard trained lawyer at one of the best employment law experts at one of the best law firms. Of course he's doing this. This has to be legitimate. Okay, so he's the guy who they took on to adjudicate my hearing. He was there for 12 hours adjudicating it. And he's been paid, over $400,000 by the university over the course of several years. He continues to have a contract with them, as I know through public records requests. And what he did is everything I was told about how it would be fair was not the case. They basically piled 10 hours of adverse testimony of them saying these horrible things about me. And then do you have any response? I'm like, what do you want? Like, what am I going to do? Like, you can't rebut 10 hours of that. And also I look crazy if I'm trying to do that. It would take me literally 10 hours to talk about it. And then I would look like a crazy person. I don't have 10 hours. They give me 30 minutes. So there's no real chance to win that thing. Of course it was unanimous. They kicked me out. And I then wrote a 20,000. And in retrospect, I did everything right here. And I'm like shocked. And I think it's because just like medicine has biology as its foundation. So if you know biology really well, you can say a couple things about medicine. If you know the arts and humanities really well, you'll understand what's fair and what's ethical and right, and you'll do the right thing. So 20,000 word appeal on my dismissal. And it was so long because there's so much to say. Everybody's like, if you read like the doctors talking about, they're like, oh, he was manic. Why did he write it 20,000? It was 20,000 words because there was so much craziness that happened. And I addressed all of it in that dismissal document. That appeal document is gold. It's going to be gold. So, because I actually did hit a lot of legal things I didn't even know existed, but like I got them. But of course they sent me an email saying, the dismissal is finalized. It was like 2 words or like 2 sentences about how, we don't accept this appeal, and it's like, fine.
And was there like a top line of what the dismissal was?
Yeah, there were like 10
on?
different things. There were 10 different things.
Okay. But fundamentally, you're a threat to other students, or what did they?
No, it was a whole range of different things. All these things that had been piled up over time. I haven't talked about them publicly. I want to get that stuff in court done. It feels weak to be like they accused me of this, but I'm like gonna argue with them. They're not arguing with me yet. But if we can get to the court, then that's whenever I want to do it. Yeah.
So the system is,
and which is not to say. No, by the way, just to for legal purposes, I'm not actually trying to relitigate the dismissal. I don't want to go back into medicine. I'm not interested in that because I don't want to go back into this system. And also, I'm so smeared. It's just it'll just be such a tough grind the entire time. I'll always be under the microscope. It's horrible. So I don't want to go back. So I'm not relitigating anything. What I'm doing is I'm basically. But what will happen is this stuff will have to come up because my lawsuit is over First Amendment retaliation and American Disabilities Act stuff. And so they're going to try to they're going to relitigate this, not me. I'm alleging that this is retaliation, and then it's going to have to be established. Well, were these professionalism things real? So I'm not relitigating these things, but they will come up in court because they have to in order for us to establish whether it was really retaliation. Just for legal, I probably already messed this up. They're probably going to take this out of context. I'm going to have to respond, whatever. It's fine. Go ahead.
Dr. DiGiorgio, what is your general thoughts in terms of the process, if you have been a part of it ever, with regards to the system that's in place for evaluating medical students in this fashion? Do you feel like can it be a fair system, or is it like ripe for abuse, and how does it normally work?
I mean, this whole process reminds me of the Lavrentiy Beria quote, right? Show me the man and I'll show you the crime. It's ironic because on one hand, you are clearly targeted here, but on the other hand, it is incredibly, maybe it's more just in residency, but it's incredibly difficult to dismiss subpar residents, at least from medical training. And what we largely find is that it's almost easier to just shuffle them along to the next rotation and the next rotation until they graduate residency. And that makes it's very difficult. Like, you have stories of residents getting through just because the school doesn't want to handle the paperwork of dismissing residents, because you do need such a paper trail, which is disheartening to hear that they can essentially fabricate one for you, Kevin, when if you actually have a resident or a med student who you think is going to harm people, they are not able to get rid of them because you need such a paper trail. So this is incredibly disheartening in that you can take competence is not an issue, but political beliefs are, and that seems to be at least why you were targeted.
Yeah.
Yeah. So why I'm circling back, Kevin, why do you think the system works? So you're talking about the meta system. You're not talking about the local medical school system. That does not appear to work, but you still have belief in the larger system in terms of justice, and the legal system will eventually slowly grind its way to the right place.
I mean, in my case, yes. I think that it's interesting what Dr. DiGiorgio said. Maybe medical students have less protections, or maybe they just like hated me so much that they were willing to, I don't know what the answer is. I mean, so they can't just like say you did things and then just like kick you out based on them. Like they can't just do that, right? I mean, that's basically what they did. I never had a real opportunity to respond to anything that they said.
And prior to the Newsweek article and stuff, there was not any issues.
My PhD advisors didn't like me sometimes because I was too honest. And a lot of the stuff, a lot of the science there was research misconduct. And I got retaliated against about that also. Not to say I didn't try to rock the boat. I was never trying to rock the boat in the sense of like filing whistleblower stuff or anything. I would never did. In fact, the opposite. But I would hold my ground. And this was, the basis of smearing me all the time. Some people's whole, 3 to 5 paper research programs were negated by data that I would publish that I would present during seminar. And so there was a narrative about me already being a problem back then. But again, that was the same kind of retaliation. And that's not a part of the lawsuit, but that's going to come up too, because they're already talking about that on the docket. But yeah. So apart from that, there's no formal anything against me ever, because if they had done anything like that, people knew that it was going to be a big problem because I had the facts on my side. I thought the same thing would hold true here. As far as the broader legal system is concerned, it's hard to say. Honestly, until sort of this AI era, I would be in big trouble because they have the lawyers. They know how to file the stuff. I don't. But with a good AI pipeline, you can actually file superior quality legal filings to the Assistant Attorney General, which is what I'm doing. My legal filings are far better than the Assistant Attorney General's are, but that wouldn't have been possible if 3 years ago. So in general, actually, I don't think the system does work. They can actually do this, but maybe at least right now, there's a weapon against it if you understand the engineering well enough, which I've done a lot on.
Yeah, I think I may have. Sorry, go ahead, Anthony.
I was just going to make a quip that in New York, you won't be able to do that soon enough because they're trying to ban the use of AI for law or medicine in New York. So they're going to take that away from you again there, Kevin.
Yeah, they've got to reestablish their
control.
Their firm hands. So.
I was going to say, Kevin, I think I was the one that erred in telling you that, I was like, Kevin, just keep your head down, just disappear a little bit, become a doctor. And then, once you're a doctor, you can start opening your mouth. Even then, though, you got to be careful, because they can always get you in one way or the other. But I may have been given your arc afterwards. So this gets to I think the very interesting part in terms of what you've done since being dismissed. You've of course been, fighting a legal battle in terms of what happened to you, which you've detailed. But you have really been very, very, I mean, I don't want to make your head too big, but from a data analytic standpoint, my goodness, you have clearly really been an early adopter of AI and its ability to kind of using AI to analyze data and come up with some very interesting stuff. So that's what you've been kind of doing. But can you tell me a little bit about what you've been doing since all this happened on that front?
Yeah, it's the same. Basically, it's the same theme. If you're really going on meta level, everything I've been doing, even in nutrition, it's the same thing over and over again. It's the same concern I have, which is, what is true, right? AI allows you to dramatically enhance your analytical capabilities. Actually, it goes far beyond this. I wish I could share with you sort of the breakthrough that I've had. I don't think anybody's doing what I'm doing right now, like literally nobody. And okay, so let's
Why
talk
is
about
that?
that. I figured something really cool out. And I don't think like people know about it within the tech community, especially like the niche, like really hardcore tech people. They know about this kind of stuff that I'm doing, but they don't understand the application to a lot of the contemporaneous issues and the specific sort of ways you could target these techniques. It hasn't been put to, so I've put that for whatever. And I don't think anybody, like I actually have talked to recently people who are deeply involved in this particular field. So me and you have been, let's see, me and you have been talking about, there's a lot of Doge stuff, right? We've been talking about that. I've been talking to people who are in that world. And as far as I can tell, nobody knows about the insane, like the sort of like X thing I have cooking right now. But basically in general, AI allows you to code. If you have any questions, like scientific questions, right? You're like, okay, how do you establish causality of this and that issue? We did this whole illegal immigration and the different policies that are the policy constellation that sort of incentivizes legal immigration with respect to voting. And I went viral for a little bit on that. You can just ask these questions as a scientist. And if you know how to use the platforms, the analysis will be done for you. And if you have a scientific mind and you're able to be like, wait a second, we need to establish causality, you can interrogate sort of the data, and the code part is sort of taken out of your hands. So it basically has this knowledge that facilitates and lubricates capabilities because you don't have to hire that engineer to do that analysis. And if you're smart enough and you are truly trying to red team or you're trying to criticize your own sort of conclusions, you can have the AI do that for you as well. And you can understand where it's going wrong and going right. And so just being scientific enough to do that, you take the technical burden off. And so, I worked a little bit with, Jay's nonprofit for a while, doing really fundamental stuff on natural language processing. I still need to get that paper out for him. I've been telling him I'm going to do that for a while. I need to establish myself financially, but that is, and once the AI gets, maybe the next jump in AI, it'll be just so breezy to get out. And I could talk about that paper forever. It's a really cool paper. When it comes out, it'll be, it's not like super, super cool, but it's pretty cool. And then we recently did the whole Epstein stuff. So you can take all of the Epstein files, you can put it in a database, and with the right kinds of tools to query that database, you can basically say, okay, everything substantial that's said about Trump or everything substantial that's said about Reid Hoffman in those files, give it to me. And of course, it takes like a day because there needs to be a pipeline. It's actually not even easy for the AI to do. The AI has to go like document by document, parsing everything. But the AI can then tell you what's important. And once it tells you everything, it can construct a story, right? Like, and you can ask, okay, what are the story threads here? Like, what is this actually saying? Give it to me objectively and from both ends and, construct a story. I can rewrite it or I can just post it raw. I'm trying to do more rewriting because some people don't like it being posted raw. But you can essentially take massive amounts of data and make sense of it at a speed at which you could never do it before. In the past, all this stuff could be done. Journalists did this all the time. In newsrooms, teams did this over the course of months. As a single person, you could do this in a couple of days, what they would take months to do for, say, the Epstein files. So that's really cool. Now, imagine, and this is where I'm probably going to say too much, but imagine if you can get all of the data, not just analyze it and put it into a database, but you suddenly have the ability to get all the data almost instantly from any issue. And imagine that there's public data about everything. Like okay, it's really incredible. Like I discovered this about a week ago. The amount of public data about like who owns what companies, what their financial transactions are, what their lawsuits are, what properties they own, everything related to Medicaid or Medicare, linked to them. There's like 10 layers of different data sets. There's so much data that's available that is currently collected. It's been collected for a long time by law that most people can't access. Now, what if you could access that instantly? And then you could put that into that kind of database and then do the same sort of Epstein files, that with regard to fraud. And that's what I'm kind of doing. And I've said too much. It's fine. I couldn't help myself. But I haven't told you what the technique is. There's some crazy ways to do this that it changes the way that I understand the internet.
Well, Anthony,
yeah.
Anthony, you've talked about it. Anthony's a pretty researcher. One of the extremely good health policy researchers and one of the guys who spend time on this stuff. Anthony, isn't part of the problem that the data sets themselves are very messy? So how is that a problem that Kevin's going to run into? Because maybe he doesn't know how messy the data sets are, or like how do you validate all that?
I was just thinking how much we've lost by not having you in the medical field, Kevin, because for example, doing research with these large data sets, we had one where we're trying to look at traumatic brain injuries, and it just so happens that the coding, when you see a doctor, the coding is so sloppy. We call it coding hygiene, or a lack of coding hygiene, that in this data set, about 40% of people had codes that were mutually exclusive. So they were coded for both traumatic brain injury and non-traumatic intracranial hemorrhage, just because nobody knew what the correct code was. So both codes end up getting entered into the system. So it makes it really hard to work with these data sets because they're so messy. Now, I imagine if you, again, thinking in healthcare, if you had AI that not only had access to the codes, but to the clinical notes, to the radiographic images, it could probably get to a closer ground truth than just going through a large administrative data set. But that, of course, requires a different level of access that you don't really have with any sort of these public data sets. You really need to get, and even working in the institution, I don't have access to, the clinical notes on all the patients in these administrative data sets. So I think it's really just going to be a level of access. What you're talking about, you're talking about people that pay for engineers to do all this data cleaning and data collection. In healthcare, we pay for nurse practitioners. These are six-figure jobs, high six-figure jobs. We pay for them to do pre-charting before clinic and just get all the patient's story and history together before the physician walks in the room. So you're paying someone a ton of money for something that AI could do. This whole idea of having somebody do your pre-charting when an AI, this is like the perfect application for everything you're talking about, is taking this messy patient chart. I don't know how it is for your patients, Anish, but a spine surgery patient that's had 3 operations and seen 5 different pain management specialists and had 7 different MRIs and CT scans. The data is all over the place. It's incredibly messy. And Kevin, for you, if you were just in our office being able to make an AI bot that could give me a 1-page summary before I walk into the patient room would triple my efficiency instead of having to pay a nurse practitioner to do it.
So you guys are probably super more about this than I do. My understanding about medical AI is all the big players are doing it. That's one of the big things that the big players are. That's one of the reasons why. But I also have friends, in Silicon Valley who are working on that stuff. Is going to be, hopefully available before the end of this year on a pretty widespread basis. I hope so. It takes time to roll out though, right? Because the regulators, that's probably the biggest problem. Yeah.
Yeah. So nobody wants to give access to an AI bot into their institutional Epic, because then that Claude bot, it starts posting it online, or it starts, giving you, Kevin Bass, all of the data of that institution. I think is going to just lead to disasters.
Tell me, what about the issue of the messy? Kevin, you just heard that. This is an issue, right? When a neurosurgeon looks at a chart and looks at code, medical codes we're talking about, not hopefully most neurosurgeons aren't looking at Python code, but when you're looking at billing codes,
but I can't interpret that.
But you heard that, you have charts which have 2 billing codes that are mutually exclusive, and you're trying to use the billing codes to figure out who has a traumatic brain injury. But the chart has, things that can't happen. You can't have a traumatic brain injury and a non-traumatic brain injury. And how the heck do you figure out who had what? How are you, is there concerns about how clean the data may be? Because the folks that ultimately put in this stuff, put it in very messily. So like ground truth becomes very hard to parse. And if you just have AI kind of searching stuff without access, as Anthony is saying, to the underlying clinical chart to validate if the patient had a traumatic brain injury or non-traumatic brain injury, how does one get beyond that? Meaning, you get a lot of garbage in, garbage out thing. Are you worried about that? How would you validate some of the stuff that you're trying to get?
So, you know, the kinds of questions you can answer depends on the data that you have, right? So,
Yeah.
if your interest, if the answer to your question depends upon that distinction between traumatic and non-traumatic brain injury, and you can't access the underlying data, then you just can't answer the question, right? So some of the stuff that I'm doing right now doesn't rely on that. It relies on a whole bunch of other records that actually are like really good, that are non-medical. There's an interaction between medical and non-medical for some of this fraud stuff. Now, yeah, it'll probably be an issue on some things like data access, and then fighting for data access. I don't know how that's going to play. I'm not there yet. But yeah, of course, that's definitely an issue. So for sure. Yeah, you're limited. Like one of the things I was trying to establish with the immigration stuff was causality between some of the Democratic policies, yeah.
Describe for us, just to give the audience a sense. What did you do, and what analysis did you do, and what conclusions did you come to?
It's a little bit stale right now in my memory, and I didn't like publish on this. I did it very fast, so I have to draw back because you have to create content fast. So the first set of analyses I did was on the relationship between welfare benefits to illegal immigrants and what was it? It wasn't immigration rates. It was actually a relationship between different policies, welfare benefits to illegal immigrants and voter ID laws. And then I just showed in a correlation, all right, and states with high amounts of welfare benefits, just like 3 or 4 different categories that are very important. You also saw really lenient or non-existent voter ID laws. And so that's interesting. Is it that we're trying to incentivize illegal immigrants to come and then to vote? I don't think that's the mechanism. I think it's part of the incentive constellation. I do think that there's I don't think it's engineered. It's just part of like how Democrats know that they're supposed to think about things, and it just so happens to benefit them. And so they push for constellations of policies that do benefit them. I don't think that's the main mechanism through which so that I showed that connection when Elon loved it, blah, blah. And then it was, people thought it was really cool. And then I think after that, I looked at maybe like immigration rates and some of these policy constellations. And so I did that. I have a couple, and I probably need to put it on Substack. And it's all transparent on GitHub. Nobody's challenged the analysis. It's all like everybody can literally look at the data and look at the code and see. But I did try to establish causality. Like, okay, is there a causal relationship? Do they put these policies in place? And then what happens is you get more votes for the Democrats. Like, is there a causal relationship? I couldn't establish that, right? Because there's a selection effect. When Democrats get power, they put these policies in place. It's not necessarily that the policies themselves, but the data are limited to the extent you actually can't answer that question because the data you don't have the granularity of data to answer the causal question for a lot of the reasons that Dr. DiGiorgio is saying on another sort of kind of data set, but a similar sort of issue. Yeah. So I that's what I did there. I don't remember the next thing I did.
Yeah. Go ahead, Anthony.
Yeah, I was going to ask, can you figure out Medicaid fraud for us? I mean, I think we're just trying to scratch the surface, but one of the arguments that I keep having with people is some people say Medicaid fraud is 1% of all Medicaid spending. Some people say it's 80%. I mean, just the fact that there's this huge range in the public discourse about how much of Medicaid spending is actually going to fraud. And I consider things like a hospital charging a 30x markup to the Medicaid program also as fraud. If you're charging $18,000 for an MRI when it can be $500, I would consider that that sort of soft fraud. But are we ever going to be able to get a handle on the amount of actual fraud in Medicaid?
Well, do you mean by including soft fraud? Because
I mean, separate it out, like the true hard fraud, the Somali daycare luring centers and all that. And then the sort of softer fraud, like you could actually get a better deal on some of these services.
Or another kind of fraud, like you don't need a treatment. The doctor knows and is knowledgeable enough to know that you could do things a different way without that treatment, and maybe even better, but then they still encourage the patient to get that intervention when they don't need that intervention. That happens all the time, right? You're rewarded in
the so-called supplier-induced demand. Yeah.
So, and they call that incentives, right? Like that the way we have these incentives, but like, it's not just incentives, because some of the doctors, they know better than to do it, but they're doing it anyway. Is that fraud? So I think that's also another kind of soft fraud. Like, so I guess, so fraud, at least legally, and I'm new to this field, and I just literally had a conversation with a guy who's an expert about this earlier today. The legal bar for showing fraud is quite high, right? So even though something like really looks like fraud, or even though it's almost certainly fraud, you may not be able to take that case to court. Is that considered fraud, or is it only the cases that you can take to court that are fraud? And so it's kind of a spectrum, right? So we've already in this conversation looked at 4 different things. Like, are all those 4 things fraud? And then how do you show them all? So I don't know if we'll ever actually have a clear answer to that. But as far as solving the problem, that is what I'm working on, literally, because that's where there's a lot of money there for me potentially, but it's also an important issue. And there are clear cases, though, and I think that and I think that using data in this new way can help to at least. So the other issue is that some of these people who are doing this fraud, especially the big operations, and I believe that there are. Let's say this. I believe that there are massive operations on a scale that you couldn't comprehend, centralized. I believe that. But the people who are running these are incredibly sophisticated and smart. So these are the worst cases. Some of the people are they know how to hide it. But I also think that with access to a lot of this data, it would take teams, like a 50-person team, 6 months I believe that you can show, for example, you take this is not fraud, just to be clear, it's not fraud, but you take my medical school case, for example, and you look at the patterns of obstruction with respect to the records requests, the patterns of apparent retaliation after I file a lawsuit, reopening debt collection as soon as I file a lawsuit. You look at just many different patterns. They're in the documentary record. They don't necessarily show dispositively the thing that I'm claiming, but they're so pervasive, and there's so many patterns and so many parts of the record. They start to put together a picture that can help create a case. That kind of stuff has become possible. But the problem is, as I'm saying, some of these people understand how not to be detected. But the paper trail that they produce in trying to avoid not being protected is itself a piece of evidence. And so that's something that I'm not a piece of evidence, but that actually is a case. So that's the problem, is they're smart operators. My hope is that that new ways of analyzing the data at a much larger scale can reveal the ways that they've been hiding their operations. But we will not be able to fully expose everything because it's a cat and mouse game.
Well, this is one area I think Anish and I sort of differ on opinion is, at least in Medicaid, I don't think that you necessarily need to show a legal case for fraud, but if you have enough evidence, because so much of Medicaid goes through managed care organizations, if you can show evidence to managed care organizations, they can then use their ability to tamp down future fraud by introducing things like utilization management. For example, if there was a large MCO that was dealing with behavioral health services, instead of just the behavioral health services billing fee-for-service directly to the state, if it instead went through an MCO and an MCO caught wind of it because someone like Kevin Bass gives them a lot of data showing that a lot of these claims are fraudulent, then they can simply institute utilization management strategies to prohibit that fraud, prohibit those claims from going through the same way they do it, oftentimes to our chagrin to doctors by doing excess utilization management. But that's one way, at least I think, that having a private intermediary can help tamp down some of that fraud. And so I guess the point is you don't need a legal case. Just need to show this is outstanding. You need to be looking at this, third-party payer. Yeah.
So the legal side is the part that I'm most interested in, because that will allow me to build up a base of capital if I'm successful there. However, if that fails, there are many lanes, and if you build up a legal case, then obviously you can go down those other lanes even easier. So that's certainly going to be part of it as well. So, and it's interesting because some of these fraud networks, there's a lot of complaints that have been filed against these people. Some of them have indictments, some of them have convictions. Some of their operations are so large that investigators have only found one piece, but they're doing a lot of other things. Well, so the legal side is also important because you want to shut them down completely because they can keep going. So, but yeah.
No, yeah. So I think I was wrong in terms of where you would have the most impact, because it may very well be that Kevin Bass, unleashed from being on clinical rotations, doing rectal exams. I don't think they do rectal exams anymore, but doing doing whatever Dr. DiGiorgio is making his poor medical students do. What you're doing now, what you're doing now may be more impactful. Surgery. Sphincter tone, very important.
I mean, if I had to do a rectal exam as a medical student, that would have been I would have gotten a professionalism complaint 100%. They would have had something ready for that. And that would have been horrible. So just saying.
Glad they got you before that.
No comment.
No comment. Yeah. So anyway, Kevin, I'm looking forward. I mean, your analyses have been, and I like the pattern of non-medical stuff that you're doing is very interesting. And it is certainly, you seem to have a nose for what a lot of people will be interested in. So I did not foresee that you would take the entirety of the Epstein file dump and, analyze it and then set up, these brilliant analyses of like, okay, because everyone keeps talking about Hoffman, Trump, this, that, and you're just like, okay, go through here. Let me show you how many times and what the timeline is for Reid Hoffman and what he did. And let me show you Elon. And of course, Elon shows up 40 times and Reid Hoffman shows up, a bajillion times, and all the, and you contextualize the Elon stuff. I mean, it is the best journalistic review in an analytical way of the Epstein files that I've seen. And it's done by Kevin Bass. Like, what the heck is going on here? Like, what is wrong? Yeah, PhD, Dr. Bass. Yes. So I'm looking forward to, what you're going to bring to us as citizens to kind of illuminate and shine light, because I think you have a combination of an analytical brain, an ability to ask the right questions, ask the right prompts, and time, because you are not, doing rectal exams.
It's funny because those skills that I built for the Epstein files, those were built creating my lawsuits. So I was like, after I had these lawsuits filed, I was like, oh my God, I have all these tools for the Epstein file. Just use them. Like, and I didn't care. Honestly, I didn't know anything about the Epstein files at all, but I knew that like they would work in this context. So I just literally moved them over Epstein files. Now, I've learned so much from the Epstein files. And I've learned actually a lot from doing this like technically from an engineering perspective. And by the way, that journalism was it was really just engineering, right? So I've learned so much. Now I'm going to move all those techniques back to the lawsuit again. So soon Texas Tech has to face the nightmare machine.
What advice, do you have any advice to physicians in terms of how we should be using AI, or is there anything that we should be doing to interrogate things, or it's too far beyond our grasp and we should just find some smart person to tell us what to do?
So this is where I think one of the other qualities about me that I think you didn't hit whenever you were explaining why I'm able to sort of pivot and do this kind of stuff is like a really high level of openness. And I just love like new things and like learning about new things. And like whenever I learn something, like a lot of people, like a lot of doctors will be like, oh, I've learned my trade, I've learned my craft, and like I'm set now. And like that's alien to me, because to me it's like, wow, like always new things to learn. And like whenever I learn something new, I feel like it's like the best feeling in the world. Literally, it's like I'm like discovering something, right? So to get to to answer your question, I know that me and for like the last, like, I don't know how long we've been talking about this, for at least over a year. We have maybe a different view about AI. I'm like a total AI tech bro, like super enthusiast, accelerate. I think we are literally this year, and this is why I did all this preface, because this is a totally new world. I don't know if necessarily we're going to get like sort of recursively improving AI and it's going to be Skynet or whatever. I don't know if I believe exactly that, but I believe that the capabilities of AI continue to improve. It appears at a linear rate. We haven't hit the wall. We thought maybe a year ago we'd hit the wall, and we've kept going and we haven't hit the wall at all. Now the capabilities are insane. I think it's much crazier than I think most people realize, especially if you know how to leverage them in like really careful pipelines. It's not just a chatbot. When you leverage them that way, you're able to do things that you're able to create leverage that one person's never had. So then the question becomes, can we keep going at this linear rate? And maybe I should not get off this topic, but like if we keep going this, it's kind of hard to know what it's going to look like. So if it stops, like right now, my advice would be what? Like, I don't know what the medical AI people are doing, but like, certainly everything Dr. DiGiorgio said is true. How to get ready for the future, your practical advice. Let's get down to like practical stuff. I don't know what the future is going to look like, Anish. I'm sorry. I can't answer that question. It's like,
That's a good answer. It's a good answer. I know. I think it does speak to, I hope folks realize that there's a huge potential here, and it's certainly worthwhile physicians that have an open mind to kind of take a look and look under the hood in terms of what the capabilities are to see how it can be useful to you. And I think it's going to be very different for, say, a private practice cardiologist versus an academic neurosurgeon versus a health service researcher, right? So it's very, very, very interesting. I'm actually super interested to see how the research enterprise may change both for the good and the better. Like, I've been just as an example, I've been a long critic about all sorts of different health policy things, right? And, it's like, how do you go and, I can write blogs and I can write op-eds fundamentally. And maybe I have a piece that's slightly insightful and it gets read a little bit. But at the end of the day, the real way,
don't put yourself down like that. You're actually getting trolls from Stat News on your Twitter. You're making an impact. It's good.
But the real way, as Anthony knows, is that the real way to rebut researchers in a certain point they have is actually generate other research. And for the longest time, I've thought the problem with much of public health research is, I'm just giving one example, public policy, health policy research, has been that, it comes from one monolithic ideologue and it comes from the left, right? And so all the research you produce, if you're a leftist ideologue, a certain kind of flavor, even unconsciously, the decisions you're making leads you to a certain outcome, right? And so, and the folks that are libertarian or free market folks are kind of frozen out because, well, they won't let you complete medical school if you, that's a joke, haha, not really. But now I'm really interested to see if there are folks that are outside the establishment that would be able to produce high quality research from these databases. The Medicaid database that was just data dump released, right? It has been accessible only to a few people, a few academic groups around the country. Now that same database is fundamentally accessible to like random person sitting on the internet, right? Who has the benefit now of having, a bunch of AI agents that can parse that data. So, it does, for somebody that can ask the right questions, similar to what you're doing, it'll be interesting to see if it'll be interesting to see what the establishment does in response to that. Like, would some journal, publish something from some random guy who's done an analysis that looks exactly the same like some analysis from, say, the Yale group, right? But it's coming from somewhere else. So, and it's all public and it'll be open source and it'll be on GitHub, right? And you can be like, oh, you can look at it and you can test it. I'm just not making it up. So, I think we're on a very interesting place. I don't know if like the average 45, 50-year-old physician clinician is necessarily going to be able to pivot to do that, but certainly, there may be some elite 45-year-olds that can, but certainly the younger folks, who are growing up in this era that are like, I'm not doing a PowerPoint, I'm just telling Claude what to do so that Claude does the PowerPoint for me, right? That group of folks. Yeah, so I think we may be on it'll be interesting to see what happens in the next 10, 15, 20 years. So, sorry, very long comment, but Dr. DiGiorgio, we'll get out of here because, we've used up enough of everyone's time here.
Yeah, no, I agree with that, Anish, completely. Kevin, it's been a pleasure having you on.
Thanks so much, Kevin. All the best, man. Good luck to you. We're rooting for you in your fight against the establishment, and I'm super curious to see, like I said, what you're going to produce on multiple different fronts, and try to get some more sleep.
Thank you.
All right.